Thank you very much, Madam Chairwoman, for holding this very timely, important, and relevant hearing on addressing comprehensive health care reform from the small business perspective. And it's just so interesting sitting here because I guess walking into the room, I thought I was going to hear sort of a uniform response, but I feel even more confused now than I did when I walked in, quite frankly. But that's what this debate is all about, to try to find a win-win solution to what is really a challenge for our small entrepreneurs. And I think at the heart of it, all of the concerns that each of you have raised. So I just want to raise a couple of questions with each of you because, again, I'm hearing different perspectives, and I guess every business is as unique as the person who has started them or the family that runs it and the people that they employ. On the one hand, I've heard concern about health care remaining in the domain of the private insurer. And it's my understanding that the private insurer has been part of the challenge in terms of the cost containment. So the question becomes, with an expansion of health care choices or options, I think that in listening, I heard commentary about concern about government, I guess, running the public option. That's not what I've necessarily heard about a public option. I've heard about public investment in a healthcare option. And I was wondering if anyone had any ideas about how that public investment in a healthcare option could be employed in a way in which it creates win-win. Because I'm not sure that I would want government folk, handling my health care either. I have health care insurance through the federal government, but I go to a private insurer to have that health care delivered to me. Has anyone, any of you, and I'd like to get all of your feedback on that, given any consideration to that? Just very quickly.
The purpose of the bill is to provide a monthly
about
compensation payment.
If there were public investment for health care, how it would best be utilized as opposed to the government actually, giving the service itself, but working as we do in most areas as a contractor that subcontracts out that health care benefit to the benefit of small business.
I could try to answer. I think I mentioned when we were talking about mandates that if you define what it is that we're talking about in the mandates, get some of the specifics, I think it might make sense to then package those specifics and lay them on the private insurer table and say, okay, guys, we want to have this objective, that objective, whatever, that are part of what we're talking about as a mandate. And then get a reading as to, all right, some of that's going to cost money. How much public funds are we really talking about, and do we really want to have, you all as politicians, frankly, want to have subsidy going to private insurance companies to make sure that some of those mandates get accomplished?
And I know someone else may want to respond to this. What about the nonprofit sector as a deliverer of health care, and how would you see that? I'm just trying to get small business to be a part of how we make this happen versus, government can't do this or whatever. You know what I'm saying? I'm just trying to see how we create as many choices as possible. And my time's running down, so whatever you may be coming from your mind creatively, please let me know.
Let me amend that. When I say private, I mean also the nonprofit pensions. Yeah.
I think that there is ways to bring healthcare costs down, technology investment, that sort of thing, that the government could well do, perhaps, to help bring the tools into the healthcare arena to help bring costs down. That would be good. Part of the problem we have now is that government regulations don't allow us to shop our insurance in areas we may want to go shop, or
Mr.
the
Chairman,
pooling
the
concepts that we
was
talked
debated
about
in
earlier.
previous hearings,
So we feel like we're a little handcuffed by government regulations. So if some of that was changed, we might be able to get more aggressive in the marketplace. But I do think that the government could provide tools to either the insurance companies or the healthcare industry overall that can help bring those costs down, and would then benefit all of us and bring our insurance rates down through either through the insurance companies that we're currently utilizing.
With the gentlelady here, Mr. Thompson, do you believe that small businesses should have the ability to pull together, be part of any legislation?
Yes.
Thank you. And time is expired. I recognize Mr. Coffey.
Able to work this out because it appeared for a minute that it might not.
Thank you, Madam Chairman, and thank you all so much for coming here today. This is such an important topic, and having been a small business owner, I can remember the struggle of trying to fund a health care plan. I got up to 50%, but only for the employee.